Greetings, Eric Bakker from New Zealand. Thanks for catching up. Got a question for a patient today from Europe, a lady here. It sounds like she's in England. My doctor told me that it was a risk to take unprescribed dietary supplements. What do I do? Well, that all really depends on what you want to do. What type of dietary supplements are we talking about? Some people I see take 30 or 40 supplements per day. And on top of that, they're taking about 5 different drugs. They take anti-depressants and sleeping pills and anti-psychotic medications and cancer drugs. And when you're taking a whole array of pharmaceutical medications, you're really better off getting a professional opinion. In my opinion, not from a medical doctor, but more from a integrative doctor, or a doctor who works with natural medicine and conventional Western medicine. A doctor who has a training in both fields. It's a little bit like going to a Catholic and asking for advice on becoming a Muslim, okay, or a meat eater talking to a vegan. You don't do that, all right? So, because you're going to get totally conflicting points of view. So if your doctor's being purely trained in Western pharmaceutical medicine, he or she is going to have no understanding at all of dietary supplements, or scant information that they learn from drug company reps that come around. And B, they could be potentially hostile towards, you wanting to incorporate some supplements into your regime. So my advice would be to go and see someone who's got a lot of experience, who's quite professional in this field, who can understand if there's any interaction between the supplements and the pharmaceutical drugs. If you're not taking any pharmaceutical drugs at all, I can't see the reason why you can't take some dietary supplements like a multivitamin, for example, or an omega-3 or a magnesium supplement. The majority of people are going to benefit from these supplements. So it's interesting how the doctor said there's a risk with unprescribed supplements when you can buy drugs like Tylenol, paracetamol, freely over the counter. I was at Walgreens in Los Angeles about a month ago. I couldn't believe all these bargain bins with toxic drugs for sale for like $2. And people buy them like candy. I mean, how dumb is that? Don't forget that one of the leading causes of admissions in American hospitals for liver failure is people who go and take paracetamol, or acetaminophen they call it over there. It's also one of the leading causes of youth suicide is acetaminophen and Coca-Cola. And that's not very prescribed, is it? So it's up to you, which way you want to go. But in my opinion, seek professional advice if in doubt. Otherwise, just be careful. Thanks for tuning in.